What would help you look after your mental health? Is it better access to a GP, a psychologist, maybe something as simple as a community to chat to every now and again? The state government has embarked on an inquiry into mental health, and the Queensland Alliance for Mental Health, that's the peak body representing around 100 not-for-profit community-managed mental health organisations here in Queensland. They have made a submission. Jennifer Black is the Chief Executive Officer of the Queensland Alliance for Mental Health. Jennifer, good morning.
Good morning, Rebecca. Thanks for having me on.
A pleasure. What is the point? What is the purpose of this inquiry, Jennifer?
Well, it's a good question. The title is to an inquiry into the opportunities to improve mental health outcomes for Queenslanders. So it's ambitious. We had a very big inquiry in 2020, the Productivity Commission inquiry, that really highlighted some problems with our system. So I suspect they're wanting to have a look at Queensland in particular and what they can do to improve the services that are offered here.
Great. And I know that you have plenty of ideas. So what is your submission calling for?
Look, I think one of the fundamental problems that the Productivity Commission pointed out was that we have a divide between what the state funds and what the federal government funds. That's kind of been in our heads a bit recently, hasn't it? Yeah. And it's no different in mental health. So what they discovered was that there's a group of people that perhaps are a bit more severe than being able to just see a GP and sort their problems that way, or they're not actually serious enough to warrant the state services in the hospital system. So there's a whole lot of people that we think are missing out on care. So our submission really is around, what does that look like, and what kind of community responses can there be to help those people that are missing out on care?
And what does that look like?
Well, I think one of the problems we have is that you either need to go to a GP or you go to the emergency department to get care. So what we need are community-based entry points so that people don't have to wait till they're in crisis until they get care, that they can actually go and talk to someone very early on in their distress and hopefully prevent that from happening. There's a new service that's just opened in Townsville. It's called Head to Health. It's led by one of our members, and the point of that service is to be open access to the community so that people can walk in there and get some advice about where to go, get a referral perhaps if they need more help, but it's information, advice and short-term intervention, if you like.
You're listening to Jennifer Black, the Chief Executive Officer of the Queensland Alliance for Mental Health. They have made a submission to the state government's inquiry into mental health. So that model that you're talking about there, Head to Health, which is up in North Queensland, who is that staffed by?
So one of the key features, so it's a not-for-profit, non-government organisation, so one of our members. But one of the key features is that they employ people with a lived experience. And by that I mean someone who has personally overcome their own experiences of mental illness, and that they work alongside people to help coach them to overcome their own difficulties. And that's a model that people are finding really useful in thinking about their own mental health.
Yeah, that's become, there seems to be a bit of a push or a wave for that style of management, someone with lived experience working with someone who has poor mental health. Is that new to Australia, or is there evidence in other countries or other territories that is improving outcomes?
Oh, look, it's not new in Australia. We've been talking about it a long time and we've been making inroads. But I think it's, yourself, when you talk to someone who's been through what you've been through, that can make a real difference to how you feel about that conversation, if nothing else. So there's an emerging body of evidence about how effective that is and how helpful people find that. And so I know there's a commitment to actually, strengthen that workforce And so we'll be backing that and being behind that as part of our submission and what we say to the inquiry.
Jennifer, there's been, and I'm not sure if last time I spoke to you we talked about this, but certainly I've had conversations over the last 2 years in particular about people just not being able to get in to see a psychologist, in particular to try and find a psychologist for a child, or even if you can find a mental health professional, and let's say it's a psychiatrist, the cost of that is prohibitive. Did you address that in your submission, or do you think that should be part of what this inquiry looks at?
Look, it will be part of what the inquiry looks at. I mean, I guess that's part of the federal funding. And so one of the things that we've been waiting to, some of this should be free, because that really is prohibitive for people if they have to pay a gap fee, even under better access when they go and get a referral from their GP. They're often paying a gap. I think it's tricky in regional parts of Queensland because although we kind of introduced telehealth, we've got a huge problem with people's digital literacy and their access to those kind of platforms to do that. So I think the geography of Queensland means that those services aren't necessarily accessible to everyone. But we have a bit of a mantra in our office, which is that not all distress perhaps needs a medical intervention. And I think that lived experience workforce is a really good example of how we could build a broader workforce across Queensland to help people in distress.
Would you like to see more of those community-based organisations, the model that you talked about in Townsville, pop up around southeast Queensland, for example?
Oh, absolutely. Absolutely. I think if there were community points of access and people knew exactly where to go and they could go there at any point in their distress, they would use that. Because I think one of the real problems is how confusing it is to know how to get help when you need it, which is why people end up in the emergency department or going to their GP.
And then, of course, we know that the outcomes can be extremely traumatic. And then the ongoing sort of care, support, recovery tends to be much longer. So, you know the Headspace clinics that exist that are targeted at young people. Do you support that sort of a model?
Well, look, I think, again, that's a community entry point that people can go there for the first time. So, some of our members run those services. We absolutely support those. I think it's difficult. I think sometimes models that are rolled out across the state that have the same model doesn't help local communities design something that might work for their communities. So particularly in regional parts of Queensland that might have some cultural diversity, that we really need to be able to find some local community solutions that work for those people as well as those models.
So you're really talking about this big middle ground. If the federal government looks after, the sort of the GPs, the state government is at the acute end of the system. You're talking about this big area in between. Can I just throw at you a comment that's come in from Peter in Windsor, who says mental health has gotten so much money in the last decade, but there seems to be more and more kids with mental health problems. If you're putting money into a problem, it should be fixing it. What's your response to that, Jennifer?
Yeah, and I think that's right. And I think that's why we're advocating for early intervention. So that's early intervention in life and early intervention in distress. They're slightly different things. But absolutely, if you can stop the problem from occurring, and throughout the pandemic, we've heard a lot about young people in particular that have really struggled with their mental health in this time. So absolutely, we need solutions that are preventative rather than waiting till people get really unwell.
Jennifer Black is CEO of the Queensland Alliance for Mental Health. 1300 222 612, that's my number if you want to get involved in this conversation. Jennifer, it strikes me that as these submissions go in and inevitably, there will be a health minister response or the Premier's response, whoever it is. What it will come down to for them is money, resourcing, how much they need to allocate to set up, to staff the kinds of, or to carry on the kind of community health organisations that you work with day in, day out. You have worked in this area for 4 decades. Are you
Yep.
are you confident that this review will be any different? That this will spark the kind of response you're seeking?
Oh, look, you have to be confident that change is going to happen. Otherwise, you wouldn't get up in the morning, would you? So we'll do our damnedest to get that message across. But to be honest, I think it needs investment because, throughout the last 3 years, we've actually been hearing we've got a conversation going about wellbeing and the impact of the pandemic on people's mental health. I think it needs investment.
I think a lot of people agree with you. Just using that word wellbeing makes me think of New Zealand as well. Remember at one point the New Zealand Prime Minister Jacinda Ardern came out I'm just trying to get the detail of it right. She included sort of wellbeing as the measure of the success of a country, essentially, rather than something like GDP.
Yeah.
Do you reckon Australia?
They're talking about mental wealth. So it's actually more than just a health issue. It's actually a whole of government response to the well-being of the whole community and valuing that in terms of economic participation and those sorts of things. We could get very technical, but it's actually, it can't just be a health response. It has to be a whole of government approach to the way our communities operate.
I was just quickly looking it up. New Zealand had a wellbeing budget in 2021 that included a $300 million investment into a range of initiatives that broadly addressed climate change in there as well, which for a lot of people affects the way they feel about the world. Jennifer,
absolutely.
Have you put your submission in?
We have, and we've asked to present in person at a hearing, so hopefully we will get that opportunity.
What's the sort of time frame for submissions and government response?
So the submissions were due a couple of weeks ago, so we've missed that. But there's public hearings going on at the moment, and what we're told is that there will be a report late May. I can't remember exactly the date, but late in May. So it's a fairly short, sharp review.
Well, I reckon we'll talk again, if not before, but certainly late May. Jennifer, thank you so much for your time. Really appreciate it.
Terrific. Thank you, Rebecca.
Jennifer Black, Chief Executive Officer of the Queensland Alliance for Mental Health. They're the peak body representing community-managed mental health organisations, not-for-profit organisations. There's about 100 of them, and they have made a submission to the state government's mental health inquiry.